Hey everyone, Mike Jackman here of the Option Group. I just wanted to put together a very short video for small business owners and anybody who has an individual healthcare policy of why Obamacare is in serious trouble right now. You may have heard in the news that Obamacare is before the Supreme Court, and they're going to decide on that. They've already had the hearing, and we'll probably hear sometime later this year. It doesn't really matter what comes out of that ruling. Let me say that again. Whatever the Supreme Court rules, it doesn't really matter because the proverbial wheels are coming off the cart of Obamacare right now, regardless of what they rule. See, Obamacare is now 5 years old, and you can't spin that. You can't argue that. It's just a fact. Numbers don't lie. It's 5 years old, and as a result of being 5 years old, there is now a history behind all the spin. There are now numerical data and facts that have come in that paint a very disturbing picture. And it's not just my opinion. Other people are noticing this. Other people are going through the data. Even people within the Obamacare administration, ex-health advisors, are noticing this. Most recently, the Washington Times came out with an article entitled, and this really caught my attention, Obamacare Flying Machine Begins a Death Spiral. Well, a death spiral is something that you can't pull out of. And Obamacare, looking at the numbers, looking at the facts, they're not going to pull out of it. They just don't have the supporting facts. Now, we've all heard that in order for Obamacare to survive, they need the young, healthy people to participate. And I'll show you in just a minute how, the wealthier you are, the younger you are, the more educated you are, you're not participating in Obamacare. Also, recently, Forbes came out online. Grace Marie Turner had a very interesting article about the actual enrollment, how it's dominated by the lowest of incomes. And I'm going to put links beside this video so you can read these articles yourself. But you might have heard, the administration spinning that, last year we only had 8 million and it's growing. Now we have over 11.7 million people in Obamacare. Things are heading in the right direction. And that is true. There are more people signing up for Obamacare. What they're not spinning, and this is something that even came out with an ex-Obamacare advisor recently, also caught my attention. A guy by the name of Doug Badger, he analyzed these numbers, and he basically said only the poorest among the uninsured have signed up. The people who are not poor, who are not getting subsidies, are just basically saying there's no value there. It's just not worth the price. So not only is he coming out saying this, but even the Obamacare's own administration, Health and Human Services, this is based on their numbers, that 83% of the people who have selected plans and have signed up are at or just above the federal poverty level. And the federal poverty level begins around $11,000. Okay? So if you're wealthy and educated and healthy, you're not signing up. If you're receiving subsidies, yeah, you're signing up, and it's a good deal. Now, another thing that's coming out in the numbers, and quite frankly, I did not think that it would get this bad, but Medicaid is also swelling. Medicaid was originally a program that put in place to help older, poor people, and it's grown by 20% since Obamacare took hold. It's basically being used as a safety net right now for Obamacare. People just can't afford the premiums, even if they're getting subsidies. They can't afford it. And I'll get into why that is as well. Now, Mr. Badger also, quite refreshingly and frankly, he cited another study by the Avalier study, and he basically said the same thing. Middle-income people are just not participating in this. Let's look at the numbers, and this might look like a lot in the beginning, but I'll try to explain it to you the best I can. If you see over the far left-hand side, the 100 to 150, that is of the federal poverty level. And 76% of the people who are in this are getting quite substantial subsidies. The yellow and blue line represents how much people are paying for their health care. So if you look at this yellow line, at the poverty level, they're paying very little. I mean, if these are the numbers on the far right, $0 to $12,000 a year for healthcare, they're getting a lot of healthcare for a very little amount of money with the subsidies. So it would not be surprising at all for this group to say, yeah, I love Obamacare. It's great. The vast majority of people who are in Obamacare are getting this. So you also hear the administration saying, oh, people love Obamacare. Well, yeah, because it's being paid for by our tax dollars and by the government. What is very alarming about this chart, which I will explain to you why it's so alarming, is that the administration, when they first came out, they stated that this basically had to be read all the way across, that we needed participation by everybody. It's quite honestly, it's not happening. The young people, the 30-year-olds aren't participating. The young, healthy people aren't participating. And the wealthy, healthy people aren't participating. The only people really participating are the poor and the sick. So another thing that is very alarming about the numbers that jump off the page is that these are not gradual curves. I thought that, well, they would gradually go up as you gradually made income. But I'll show you a hypothetical situation of why people can basically fall off a cliff here. Let's take a hypothetical situation of a couple. They're at 150% of the federal poverty level. Okay, that's $23,895 a year. If they make just $3 a week more in a pay increase, and that bumps them up to 151%, they're going to have their deductible triple. So never before in our society has there been an incentive to say, oh no, don't take that raise, don't take that next job, don't try to achieve more with your work and in your station in life, in society. Stay where you are, because if you try to get more, if you try to get paid more, you're going to be penalized substantially in healthcare costs. And that works for single people as well in hypotheticals. The system is designed that if you gain more income, you are deeply penalized. Mr. Badger basically has validated the fact that people understand the system. One of the arguments coming from the Obamacare administration was, we kind of fumbled the website. And by the way, that was a $2 billion thus far, just to get the websites up. Said, people understand it. Yeah, the numbers don't lie. People understand that it's not a very good value. And the declining participation in this is because of the value proposition. So there's another expert who basically says, Bob Lazowski, very well-known healthcare expert, basically says it's called he calls it the Obamacare dichotomy. There are two camps. You're either getting subsidies and it's a good deal for you, you're not paying very much money, or you're not getting anything and it's a horrible value. And he has a novel idea. He basically says it's a lousy program, it's a lousy product, it's being forced down our throats. And he said, hey, why don't we try something different? Why don't we try producing a product that is actually worth the money? That's what we try to do at the Option Group. So here's the little secret in healthcare. About 98% of all the claims made were under $5,000. This is what the insurance companies really don't want you to know. 98% of all the claims were for under $5,000. The top two segments of the pyramid, they're actually the catastrophic things that happen in life. The $60,000 emergency appendectomy, the car accident where you have to have both legs have multiple surgeries to repair them. Those things happen. It's important to be covered for that. But the vast majority of claims are under $5,000 for the lower stuff. It's not a surprise that deductibles have gone up 326%. It's not a surprise that deductibles can be $5,000 to $6,000 to $9,000 a year. And you still have to pay a very hefty monthly premium. Basically, you're paying the insurance companies that monthly premium, and you're paying for your own health care out of your own pocket. It's just not affordable. It's not sustainable. And it's why Obamacare is broken. Another reason that Obamacare is in the death spiral, let's talk a little bit about the insurance risk pool. Right now, as I explained through those numbers, that most of the people coming into Obamacare are in the lower end of things and not healthy and not young, that the insurance companies are going to be drowning in this risk pool. Imagine a pool of all elderly, sick, with health conditions. It's just not sustainable. And the blowback to that is they're going to be raising premiums substantially in the near future. What we try to do is carve off healthy risk pools and manage those risk pools. There are solutions out there, just to let you know, outside of Obamacare that are totally legal, totally legitimate, but it's a fallacy if you think that Obamacare is the only game in town now. Very smart companies, there's multiple companies, have said, hey, the wheels are coming off the cart. We can offer phenomenal coverage if we manage this risk pool. This is kind of going back to the older days where you pay for what you want. You're not forced to pay for birth control if you're 65 years old. You're not forced to pay for mental health coverage if you've had a very healthy life and you have your sanity. So feel free to give us a call. There are solutions out there, and we're very good at delivering value propositions for our clients. Thought you should know.